lot of people are really excited about the application of AI in health right now. Yes, I share the excitement for all of the promise that it could bring to clinical care and also the administration of medicine. I see sort of my job as a lawyer and ethicist to make sure that it doesn't compound disparities or make existing inaccess worse. There's two areas I think we should watch in this space. One is policy. What are the governing standards that will be set? Will it be the government leading the way, or will it be the technology companies saying, here's what we can do, and therefore we are going to do it? The other area I think to focus on is liability. If I'm a doctor using an AI tool that was designed by a private company and the patient gets injured because of the use of that tool, whose fault is that? Is that my hospital's fault who gave me the tool on my phone? Is it my fault because I should have known better than to rely on that tool? Is it the company's fault because they designed a tool that can generate errors? And we just don't know the answers to those questions right now, but it'll be really interesting to see. One of the areas that I focus on in AI's intersection in medicine is making sure that the databases that AI technologies draw from are representative of and generalizable to a diverse group of patients. We actually did a deep dive into Michigan's genomic databank, and we realized that we were much more likely to recruit older white male patients. We didn't realize until we went back and assessed it that we were doing this. It was completely unintentional. And the reason for this is because we were recruiting in pre-op. But the people who are sitting in pre-op are much more likely to be insured, and that makes them in our patient population more likely to be older white men. We were able to take that information and they altered recruitment practices, and now we've been able to resolve it because of that research. There's lots of different levels that we can start to consider when we're deciding how to make AI safe and ethical. One of them is patients' knowledge of what's going on. There are state laws that are starting to be passed now that are going to require that practitioners, when they're using an AI tool, disclose that to the patient. I understand the rationale for that, but it's also important to ask yourself, would you want to give your surgeon input in what kind of scalpel she's going to use for your surgery? Where's the line between things that we should be specifically disclosing to patients versus is just part of medical care? My hypothesis would be that in the future, AI is just going to be a tool like many of the tools that we use in the clinic. And in fact, we're already using many of them: predictive modeling, diagnostic tools. And it's not really clear exactly where the line is, but that's why I think research into patient preferences is so important in this space.